Those are the top stories. Now, let's bring you this one that's developing this afternoon. The country has now registered one more laboratory-confirmed case of cholera, bringing the total to 6. The health department says the latest patient is a 19-year-old female. She was identified by the outbreak response team. Now, one person in South Africa has died from this disease. Let's discuss this latest development with the spokesperson of the health department, Foster Mohale. Foster, good afternoon. Welcome to today. It must be concerning that now we have a 6th confirmed case of cholera in the country.
Good afternoon, Nadine John and Dan, and good afternoon to your viewers, and thanks for this opportunity once more. Yes, as the Department of Health, we can confirm that the country has recorded one more cholera laboratory confirmed cases of cholera today. So this takes the number from 5 to 6. But what is concerning is that now this is the second case which was detected from one area, which is an informal settlement. And you will know that most people in the informal settlement, they share a lot of things like your bathrooms, the water taps, and all those things. And as you know, that the cholera spreads mainly through things like water. So we're very concerned as the Department of Health. Hence, we are going to intensify health education and contact tracing in those affected areas in order to ensure that we reach out to as many people as possible.
Have you been able to establish yet, Foster, where is the source internally of cholera? Where's the original source? I mean, when we started reporting about the cholera, it was a case that had come across our borders from a traveler from Malawi.
Yeah, no, so far we have not yet established the source, the local source of transmission of this cholera, and also have not yet established the link between all these cases. So if we were to establish the links between all the cases, it was going to give us clarity as where could be the cause or the source of these cases. Hence, we want to say we are going to intensify our contact tracing and also health education, also appeal to all people who display any cholera signs and symptoms to go to our clinics. And also I want to emphasize that this case was detected during our contact tracing by our health officials who went to do the contact tracing in the area of where the deceased has passed on. So that's where we managed to detect or came across these 2 cases, of which one tested negative, one tested positive. So you can see that there's a local transmission of this in one area. So this is what we're going to try to work with other sectors of the society, like other departments, in order to ensure that we are able to break the transmission of this infectious disease.
And so far, it's only about in and around Gauteng, Foster, am I correct? Are you concerned about possible outbreaks elsewhere in the country? Because people do move around.
No, definitely you are correct, and we are equally concerned that so far it's in Gauteng, and also as I indicated on that, what also is worrying is that these cases now they're getting detected in an informal settlement where people use a lot of things, your bathrooms, your common bathrooms, common water, and this infectious disease spreads mainly through this the sharing of items. Appeal to people in other provinces to say once they exhibit as cholera symptoms, they don't have where we're able to test, because we understand that people, they move from one place to another. So before we detect cases in other provinces, in other areas, informal settlement or townships, we need to do more in the affected area so that we're able to arrest the situation.
Okay, so do you think local authorities should also ramp up their track and trace efforts, the local health authorities in various parts of the country?
Definitely, especially the municipalities, because this is happening at a municipal level where people they are residing in in crowded areas. So we are going to work closely with the local authorities, municipalities, but also other sectors of society, non-governmental organizations, in order to ramp our awareness and also contact tracing to reach as many people as possible. Also, what I need to emphasize that after the death of the first patient, we went to these affected areas. We managed to reach over 1,200 people, and that's where we managed to identify these 6 cases during that campaign. So you can see that if you can do more, try to reach as many people as possible, you may find that a lot of people and more people they may display these cholera symptoms, and will be able to refer them to hospitals without any delay.
Thank you very much for your time this afternoon here on Today on eNCA. Foster Mohale speaking on behalf of the Department of Health. A 6 confirmed cholera case now in South Africa, and all of them have been in Gauteng.